I'm Dr. Peter Greaney. Thank you for joining me for this brief presentation on medical treatment, first aid, and OSHA recordability. WorkCare has offered injury management services to employers for more than 20 years. And as part of our best practice approach, we promote early reporting, immediate access to occupational health professionals, and solutions to help injured employees return to work and stay at work. It's important for us to understand the nuances of OSHA reporting requirements and how to maintain care at a first aid level when medically appropriate and ethical. We should be able to distinguish between a recordable injury and a compensable injury. Let's get started. From a public health perspective, the OSHA record-keeping log was created as a tool to help measure the burden of injuries and illness on society. The U.S. Bureau of Labor Statistics used data from record-keeping logs to track, analyze, and report on injury and industry-specific injury and illness trends. OSHA uses recorded injuries to spot higher than average incidence rates so that they can target inspections. Regardless of the changing political climate in Washington, we do anticipate our clients will want to continue to use recordable injuries and incident rates as key performance metrics. So it's incumbent on all of us to be able to articulate understanding concepts and rules. We can refer to OSHA's definition to ensure differences between first aid and medical treatment are not misinterpreted. So what is recordable? In essence, anything not on OSHA's first aid list has to be considered medical treatment. Employers must record any work-related injury that results in a loss of consciousness, in a days away from work, a restricted work, or transfer to another job, and any work-related diagnosis of cancer, chronic irreversible disease, fractured or cracked bones or teeth, and punctured eardrums also need to be recorded even though medical treatment may not be necessary. There are also special recording criteria for work-related cases involving needle sticks and sharps. In essence, OSHA defines first aid as using a non-prescription medication at a non-prescription strength, giving a tetanus shot, cleaning or flushing a wound on the surface of the skin, using wound coverings such as bandages, band-aids, butterflies, or steri-strips, using heat or cold therapy, using any non-rigid means of support such as elastic bandages, wraps, and non-rigid back belts, using a temporary immobilization device while transporting an accident victim, drilling a fingernail or toenail to relieve pressure or draining fluid from a blister, using eye patches and removing foreign bodies from the eye using irrigation or a cotton swab, removing splinters or foreign material from areas other than the eye with the tweezers, cotton swab, or other simple means, using a finger guard, drinking fluids for relief of heat stress, or using massage therapy. You can review this entire list of first aid and medical treatments on OSHA's website. Look for Regulation 29 CFR 1904. Sometimes there's also confusion about whether an injury is a compensable event or a recordable event. Sometimes it's both. Insurance companies and state workers' compensation laws define what is compensable. For example, when someone slips in a parking lot on their way into work, it is a compensable injury. But from an OSHA perspective, it is not recordable unless the person has clocked into work. If a person has clocked into work and slips on the way making deliveries between buildings, it can be both recordable and compensable. With regard to medical treatment, the three mistakes that I see that are most often made involve prescription medications, uses of braces, and prescribing exercise. Let's deal with medications. We can recommend over-the-counter medications at the over-the-counter dosage. Anything beyond that may trigger medical treatment. When a prescription is issued by a doctor, it is recordable. even if the employee does not fill that prescription. Consequently, we don't recommend antibiotic eye drops because they are considered medical treatment, but also because they have no benefit for most of the trivial eye abrasions we see. I've reviewed all of the OSHA letters of interpretation to get clarification on some of these and other related issues. Recently, I was asked to investigate the use of kinesiology tape, or K-tape. Initially, OSHA considered this medical treatment, but they reversed their opinion and no longer consider use of K-tape as medical treatment. Finally, let's deal with exercise. If an employee participates in a pre-work shift exercise, and I refer them back to that as a means of dealing with a ankle or knee or back strain, then it does not trigger medical treatment. But if I prescribe a specific exercise beyond these general recommendations, this could trigger a medical treatment case. Athletic trainers and massage therapists tend to have more leeway than physical therapists and chiropractors. When they provide hands-on care, their interventions can be interpreted as preventive and non-recordable. We use on-site industrial massage programs, and it's legitimate to classify this as first aid. On the other hand, chiropractic manipulations and physical therapists who use hands-on care trigger medical recordability. Finally, I'd like to clear up confusion centered around work restrictions. We encourage all injured workers to resume normal activity as soon as possible. We cannot recommend work restrictions at any time beyond the date of injury without triggering medical treatment. The terminology we use can be helpful. For example, with an ankle strain, I might suggest no climbing in and out of equipment on the day of injury only without triggering medical treatment. I could recommend the person walk as tolerated. I can also suggest working at a slower pace, but I might recommend not participating in sports for a few days. None of these recommendations would make it a medical treatment case. I recognize every incident has its own unique set of circumstances, and our goal is to provide the best possible guidance with a full understanding of the factors that can influence the outcome, including recordability. To summarize, we know that employees with first aid level injuries generally do best when they receive immediate care guidance and are able to return to work. If you have questions about any of these issues, please don't hesitate to ask. Thank you.